Hey girl, Marissa here. You are listening to the Codependent Dummy podcast. As a young woman, you have been raised, reinforced, and rewarded for putting the needs of others above your own. Now, in your 20s, you're finding yourself exhausted, exasperated, and enveloped in shit relationships, especially the one you have with yourself. Codependency is a way of being where we put the feelings, wants, and needs of others above our own in an unconscious attempt to meet our own feelings, wants, and needs. Sorry to break it to you, sis, but that is not sustainable. This podcast is to help you undo all that so you can stop playing small and start taking up space, you dummy. Let's get to it. Hello, everyone, and welcome back to the Codependent podcast. Today, I'm with Randi Kofsky. Randi is a licensed marriage and family therapist based in Santa Monica, California. She offers dynamic and experiential therapy that is attachment and trauma oriented. In addition, she provides work that is body informed and at times therapeutic touch informed. Randi, thank you for coming back to the pod.
Well, thank you so much for having me. It's delightful to be here again.
Awesome. I will say, Randi, I have some devoted listeners who also happen to be my parents. My dad is a therapist, so he's not just a listener, he also is within the field. And since your episode aired, he has probably, because he can't do it on his own, has asked me to send him the link to share with his patients and or colleagues like 15 times.
Oh my gosh.
He's
Wow.
such a fan of your episode. So
How
yeah,
fun.
so just know he really appreciated your message and he wanted to share it with lots of people. So I will give you that compliment from him.
How wonderful. Thank you so
Yeah,
much. That's great. That's
you're
great.
welcome.
Yeah.
Okay, so let's revisit the typical two. So first, how do you conceptualize codependency? So in your previous interview, Randi, you defined it as, quote, the tendency to put a person, place, or thing in front of one's core experience of themselves, which then leads to a chronic not knowing, right, the base level of oneself, or you said like the feelings of oneself. And
Yes.
you also said we get, quote, wired as a, like, this is a tendency, or we act in this way of being. Anything to expand on with your definition?
Oh, that's actually a pretty good one. I think I would use one that's a little more though, basically, right, referencing a person, place, or thing outside of us to feel better inside. So I think it's the tendency, but it's this unconscious impulse, and then through this work, through the work that you're doing, right, we're trying to make that tendency conscious,
right?
And that's how we could rewire and switch and all the other things that I said last time. But I think that's on the just kind of word on the street. Codependency is where does one do that? Where does one find oneself doing that? Going out to, there's a feeling that happens inside. It's uncomfortable, but it's usually something that's very well normalized, right? It's something that's very familiar, and so then to work with that familiarity, we learn to go tend to something outside of ourselves, use something outside of ourselves, do something to make this inside experience feel calmer, better. And then we're though initially hooked into something else to come back to ourselves.
Right.
Yeah.
And for your experience, you did talk about growing up, so your experience of codependency. You talked about growing up having a family member who was disabled, and as a consequence, right, like just because of the dynamic and the context, there was this need, like you said, for us to care for that one who needed a little more help. And I think I'm putting words in your mouth, but it almost led towards you having this predisposition to be codependent, right? To just kind of, yeah, kind of shift your needs for the needs of another. And then you talked about in your practice working with recovering golden children. So another example from your life or your practice of, yeah, your experience with codependency.
Well, I mean, I think there are certain points in the life experience where I don't know if it's necessarily that it's the label of codependency per se. It's just the nature of the situation, right? So when I'm referencing my family dynamic, it was the nature of whatever the dynamic was. It wasn't so
Right.
much that it was, a pathological thing. What, as the branch grows, so the tree, or the tree grows, so the right. This sort of just like it was already formulated to have those grooves in it.
Right.
And so I think, for example, a lot of women I find will come to my practice after in postpartum with their like a year, at least a year out of postpartum with their last child that they that they plan on having.
Mm-hmm.
And so, or just that reaches a point where they're just like, okay, I there's a lot going on, and I need to somehow reclaim this new self that's emerging as now having different roles. How do I get back to some semblance of who I now need to be, right? So it has this interesting before and after language, or it's before and after language. So it's just like, how do we bring it all in and then go from there?
Right.
And so that's a wonderful population that I get to work with a lot in my bodywork practice. Oftentimes, for whatever reason, a lot of the women that have showed up have been in therapy or are in therapy. So that piece is, the more talk piece or somatic exploration in that way is being handled elsewhere. So then the body work comes as this like real foundation of, there's no thinking. You just kind of immediately drop into, this is this grounded experience. And that between those two things, a lot of insights, a lot of awareness, a lot of just different needed pieces kind of weave together and really help a lot of people enter that next phase that they're looking into.
Right. And I'm curious, right? Like early motherhood is a point in the life experience where, yeah, it's like how can that be codependent? It's just early motherhood. So yeah, like you said, not necessarily pathological, but just this need, right, to, yeah, reclaim this new self, right, kind of make sense of the before and after. Um,
In a non-thinking forum,
right, non-thinking
because the
forum.
brain's already, that's kind of what happens. It's like deluge of like all these new things to consider, and there's now another person and all this kind of that. And so and that through the years of early childhood, um, different formulations come in with that. So to have something that there's no brain power really involved
Right.
is welcome.
Yeah.
Often.
Um, like, have you worked with women where you're like, oh, like this is leaning into more pathological and or like codependency, and like what behaviors or what has that looked like?
I mean, in the end of the day, it comes down to the thoughts
Mm-hmm.
and where are the thoughts going, and how when the thoughts come in, then the impulse to then follow outside.
Right.
So it becomes this like redirect. It's like, okay, where can we even begin to notice where that happens? That on its own is a large event that we're excited about, because like we're saying, there's so many of these deeper grooves are formulated, and especially when people show up to these times in life when they're already coming from a family dynamic where those are already in play, like we said before. So then there's more of the tendency is larger, and it's well grooved. It's just easier to kind of fall into these deeper, okay, I'll think about myself later. I'll keep putting myself off in different ways throughout the day. So to what we're saying here, coming for, let's say, body work, just to redirecting, to just stay with that, stay with the breath, stay with that feeling on the table, stay with the muscle aching, right? Just stay with whatever's happening in the present for the person on the table is that's where the rewiring really is beginning.
Mm-hmm. Got it. Okay. Well, you're already starting to define it, but for those who are new to body work, let's just start with that, Randy. What is body
Yes.
work?
So I always kind of talk about body work in relation to massage, right? Because I think that's where, why wouldn't I just go get a massage? Why would I go to a body worker? This, I think, becomes the crux of the issue. So body work is basically, in my definition, is when you're completely referencing the body that walks in that day. So when typically massage therapist, someone's working in a massage therapist capacity, let's say, there's some sort of plan, right? There's a signature massage. There's like, okay, for the most part, I'm going to start at the head and go down the back and then work the legs, right? There's some sort of just method, which is lovely and wonderful. It feels great. I mean, nothing wrong with it at all. And most body workers start as a massage therapist. And then at some point find their way, like, oh, wow, I perceive the body this way. I pick up information this way. There's kind of like a process that one enters into more of a body work capacity. But when we're talking more about the psychology of and the psychotherapy angle, it's more where does this body hold the emotional experience, and how is it being expressed? And so that is I would say, philosophy of the body worker. And so in body work, there's no, you could potentially spend the whole session on the shoulder, for example. Wow. Right? There's no like, I need to cover different body parts and make these other connections, because you can ultimately work with the emotional body wherever it's showing up.
So where does this body hold emotion, and how is it expressed? Was that the question?
In this context, yeah. I mean, if people come to me, so people come with different things. If someone comes in with kind of the leading feeling of, I don't know, I don't feel like myself anymore. I need to get back to feeling like myself, right? So this is typically going to be when there's some sort of death that's come in, whether it be the death of an actual loved one, the death of a relationship, whether that be personal or career, these sorts of larger pieces where it just feels so frazzled to be in a body. So that's kind of grounding the body, and and letting other experiences that aren't able to happen because there's no feeling of baseline. But then there's other times when people come in when, let's say, this are other kind of flavors of codependency, where let's say someone, this happens a lot. Like most of us are so really, a lot of people, especially in Los Angeles, are very interested and very committed to their fitness routine, their relationship with working out. Mm-hmm. And so, which is amazing and certainly has its benefits. But sometimes the desire and the enthusiasm to get the workout, then if there's a way that the little aches and pains that are popping up to like say like, hey, look at me, get kind of dismissed.
Right.
And so that over time that could lead to a real feeling of injury of like, I pushed the envelope too far and now I can't work with my shoulder really hurts when I lift it. And then it's like, oh no, what do I need to do now? Or then comes the fear of like, now what if I can't work out? Like, so people come in to see me with that so we can kind of unpack what's happening anatomically, how serious is it really? And obviously, then go through the other venues that need to happen, whether it be physical therapy or going for an MRI or, anything more in the medical world. But then if those things are that it's deemed that, okay, there's not an actual tear or something that needs to be dealt with, there's a way in which body work, working with trigger points, working with the myofascial can really unwind whatever has been happening in the body that hasn't been addressed.
Wow. Yeah, as you're talking, I'm just flashing back. I think we talked about this last time you were on, but like different stages of my codependency, or even like being in like my codependency taking form in different types of relationships, right? So like, when I was with this one ex-boyfriend, like this is where my body tended to like be really tense, right? And then I, got rid of him. And then I started being super codependent at a job, and my lower back was, the pain was just out of control. Quit that job. Went somewhere else. Then my shoulders, right? But yeah, right. This question, where does the body hold the emotion, and how is it? It sounds like initially, most often when people come to you, I mean, would you say the question is how is it being expressed, or like how is it not being expressed?
Well, those are examples. I'm sorry, go ahead.
Well, just, it's like sensed, like I could sense something was off in my lower back, but there were a lot of emotions I wasn't expressing, at this shitty job I was super codependent at.
Sure. That makes complete sense. I mean, at the end of the day, it just seems like around the world with the tension of the body, right? Just kind of following. It's so interesting and so useful to like park it into different circumstances because you get to really see it on the screen. But what you're speaking to, right, is kind of the experience of anxiety, which ultimately is a body-based experience. The anxiety is held in our striated muscles, and you're describing that to a T. Right. So it's I mean, it can go deeper in the body too, but most of the time, where it's expressed, it's the body showing where those were being expressed. So if you had come in, let's say after the job and been like, I don't know, my back just hurts, I keep getting a new chair, we're getting ergonomic assessments, all the different physical things that we know we can do, but it still kind of doesn't feel stable or like solid. Like it just doesn't feel just completely out of pain. It feels a little stiff or whatever. Then that's the body expressing like, oh, there's something being held here. Right. To me, to the bodywork hands. So then we would check and see, just even holding the low back, the tissue would be expressing like, oh, because one part's going to be, one muscle's going to be really tight, right? Versus another muscle might have a little more give. And so, and then the even more interesting thing is sometimes just having a hand there, right? Like no intellectual analysis necessary. The hand just going straight to that part that hurts, something begins to change in the body. Right. It becomes ICU.
Mm-hmm.
So,
Yeah.
yeah, it can go really visceral and to the heart of the matter.
Right. Right.
Which is why I think it's becoming more and more a way that people are seeing, like, oh, a way for me to really process in a deeper way what I'm doing in the therapy room.
Yeah, totally. I went to a huge therapy conference in November. Yeah, I think it was early November. And I went to a variety of workshops, saw a variety of, professionals. And I hear like a huge theme walking away was like everybody was like body, 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 body. It's like, okay, let me get that in my head.
Somatics are in the
Yes.
place. Yeah.
Yeah, it was
Mm-hmm.
so um universal. Yeah, like with again, like this huge variety of presentations. Yeah, and so yeah, it's hard because yeah, talk therapy. It's talk therapy. Um, but yeah, trying to integrate it more. It's yeah. So I'm glad we're talking about this.
Yeah, and I mean, and
Go
there's
ahead.
so many, and to that point, right? There's so many different ways that the body's being brought into the therapy room, right? If it's not um, something on the lines of somatic experiencing or internal family systems or EMDR, right? All the different ways that we're referencing the body in different ways, and this settling in, like, oh, right, well, before I go talk about topic X, what's happening here, or the therapist being able to reference that, which really does help then grease the wheels for coming into a more touch-based session, because there's already been some access connecting the two, the mind, the body, mind, whichever way you want to come in on it. But I think, to what we're talking about, where it gets into this chronic pain place, because you can easily, as we've had clients as well as, could have been us, chasing the symptoms of pain when there is this larger emotional component.
Yeah. Yeah. My chiropractor for my lower back pain never was like, do you need to quit your job? Like, yeah, it's like what's really going on here? Yeah, we were
Right.
just dealing with the physical symptom. And then yeah, even my therapist was like at the time was like, "Oh, I'm so glad you're going to see a chiropractor." But yeah, there
Right.
never was like the connection of like yeah, what in your life could be contributing to this pain? Mm-hmm. Yeah. Okay. Well, in your work, Randy, um, right, body work, um, there's this connection with a secure attachment. And before we talk about that, I'm curious, how do you compare a secure attachment with the anxious attachment style of most codependents?
Well, it's interesting. I mean, my take on attachment is that at the end of the day, we all have all of them. We all have all attachment styles.
Mm.
There's one that 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 we tend to gravitate towards, right? It's a tendency, another tendency
Really?
word.
I've never heard anyone say that. And I actually
No.
totally agree.
And so it's coming a little bit more. I think I've seen it on, in a little bit more in people's larger discussion of it, because I think people are understandably somehow thinking like, oh, I just have to heal my whatever attachment style, and then I'll be secure attachment forever or something like this. And
Right.
those are broad strokes, and but I can understand how people would think that as well. So it's, everyone is experiencing secure attachment in something. It would be very difficult to be living life without having some secure attachment have some experience of secure attachment. It's though the places where we are often have that inclination to be insecurely attached,
Right.
that we need that support to come in, or that to start to see, oh wait, here is where I start to go off and go outside of myself.
Right.
So or help somebody, or just find a reason to not connect with what's happening inside, and then offering something to somebody through that, but going out and being like, well, let me help you, and then I'll deal with some need or what's going on with me.
Mm-hmm.
So when we say secure attachment, and we talking with body work, right, it's that experience happens automatically. There's no having to, well, let me get back to the part that feels secure inside, because the body automatically is like, oh, I'm supported on this table in gravity, in space. I can be horizontal. And then it's easier to be like, and then through whatever rapport we're able to build in the first few minutes of knowing me or my website, or whatever way people feel like, oh, okay, this person might be someone that can be of assistance. Then we have the table, and then it's just like, okay, then trusting what comes through in my hands. And so already we're in the world of secure attachment, which is a calm, different levels of trust.
Right.
And and just an ability to be there and not have to do anything.
So what happens, to the person who can't get there, right? Because, I would hope everyone would voluntarily sign up for a bodywork session or a massage.
Mm-hmm.
But yeah, what about those people who are so anxiously or insecurely attached that it's a hurdle even to get there?
Yeah. Well, I mean, there's two ways to kind of go about that. I mean, the first is, as great as any modality can be and has research to back it or whatnot, there's times when it's just not appropriate for someone's nervous system, and that's just the way it is.
Right.
Not a problem, right? I see it like a circle. It's like, okay, well, we'll just keep going around, and eventually, if it's supposed to stop on this part, come on in. Going around the circle idea. But there's nothing wrong with body work, just not for me. Okay, great. Like, let's work on walking, or work on, right? There's so many ways that we could get into the body without necessarily having to be in the form of a bodywork session.
Right.
That said, if someone says, no, I know I need to do this, it's calling to me, I've thought about it, different people have mentioned it, and I want to do this, but I'm very scared and it's bringing up a lot of stuff for me, we work where people are. You sit in a chair, and I'll put my, we'll see what it feels like to put my hands on the back and see what that feels like. There's no protocol that must be followed in the sense of that, we must start, and someone must be on the table per se in a certain position, face down, and so, feeling vulnerable, or the other way. So, there's always, I have massive amounts of pillows, there's different ways to introduce the body and touch in a way that's therapeutic.
Right. And yeah, like you said, right, like being on the table, like this like safe sense of touch, like helps, like, I don't know if it's like even like promote or like access this secure attachment. Other ways, like you've observed that body work can help, with accessing that secure attachment. It sounds like within
Yeah.
oneself and with another.
Yeah. I mean, I think just even the breath will settle in a different way. It's just oftentimes the the caveat, right, of knowing too much about it is that then the mind starts to come up with some idea of what it's supposed to be like. And so there really isn't one, right? I can tell you that, most people who get off the table, do have some experience of like, wow, I feel really relaxed, or I feel taller, or I just feel more present, or right, these sorts of comments, which are great, but they're not some kind of like gold standard of, if you don't reach that place, it wasn't worth your time. But typically somewhere within an hour session, something's going to shift. Either a muscle's going to relax in a way that feels different, the breath will deepen, or just enter another level. Or maybe someone will just not think for like 5 whole minutes.
Right.
So there's just so many ways to explore, because we have the body, which is holding our entire life, is the focus. And the body that's been present for every single experience in this lifetime gets a chance to have the spotlight.
Right. And how have you observed body work helps with anxiety?
So kind of back to what we were saying before with the striated muscle, because the anxiety is an experience of the body. We often think we have anxious thoughts, but the reality is that experience starts in the body. So with anxiety, it's really about laying claim to, okay, when I have tension in my shoulders, there's anxiety there. It's an experience of anxiety. There's tightness and tension in the body. That's anxiety. How can I then directly connect to that? So, right, take out the whole my shoulder hurts and bring in like, oh, this is anxiety. How do I directly relate to my anxiety right now? So it's already kind of bringing in another level to it.
Right.
And then at the same time, releasing a trigger point in the shoulder, it just feels really good, right? And so, I mean, there's some things to that, we can bring up all the different, inner workings that are happening. But at the end of the day, it's just an immediate embodied experience of like, oh yeah, okay, that was tight, now it's not.
Right.
Right, which adds to this idea of trust, or of it's okay to be present with how I feel now. It's hard to be present when I'm in pain. When I'm out of pain, it's easier to be present with my experience.
Yeah. And you, like, if we had been working together when I was at that job, and I came in and I just said, I just have a lot of tension in my lower back. Unlike the, typical, like, full body massage, which, you kind of have to, like, check off, like, head, shoulders, knees, and toes, or whatever. It would just be a full session, potentially, if needed, where you're just focused on my lower back. That would be the focus.
Well, we would take all of our cues from that. Right? I don't have an ongoing like, okay, well, to your point, like check off the list in the mental list of what needs to happen for it to be a decent full body massage. And then it's like, okay, so we have the low back that's tense. So we want to know what the experience of the low back is. It, on a scale from 0 to 10, where is it now pain wise? And then we want to know both emotionally and anatomically. Well, what's happening with, for example, the psoas, which is very deep hip flexors that are connected oftentimes to back pain.
Right.
And so, are their hips tight and that's affecting the back pain, or the hamstrings tight, right? So we have our anatomical pieces that we want to consult as well. Right. And then then the more the emotionality is going to be, well, what do the muscles feel like? What's exactly going on with the muscles? Is there, when there's made, touch contact, do the muscles recoil? Are they do they become like, violin strings? Or is there more of this relaxation and kind of just like, oh yes, please, I like that touch feels very like soothing. Right. So there's almost, as you can see what I'm saying, there's more of this like conversation that begins to happen between the hands and the muscle tissue.
Mm-hmm. I love that conversation. Go ahead.
Yeah, no, same thing. So, and then it might be that, okay, at some point the low back's not going to want to be touched for 60 minutes, let's say, typically, right? So then it's going to give some directive to move up to the shoulders, or to the knees, for example, because you're following the tension in the muscle tissue, right? There's a directive place how the muscle is formulated. That there's a way that will, it directs the body worker to where the next place is that down the chain that needs to unwind or open. Right. For the whole situation to calm down.
Right. And yeah, I'm reflecting on like some like sports injuries I've had. Or yeah, like just even like other like types of pain. And like, I'm curious in your experience, like how often is like the trigger point, like the real center? Or yeah, like I feel like, I'm a runner, and like, I ran too much, of course, and my hip was hurting, right? But I went to my doctor and she had me like, flex both of my knees. She's like, oh, you have runner's knee. Your inner thighs are too weak, and your outer thighs are just, just so strong. So yeah, so your knees are starting to go out, which is affecting your hips, which is why your hip hurts. So it wasn't like, oh, I need to go and treat my hip, right? It was like we kind of had to build backwards, and like I had to really focus on my inner thigh strength. And so like how often, like would you say it's like 100% of the time that like there is this pain, but then there's like this like trail that you need to go back and like kind of repair like this area in the body? Does that make sense?
Oh yeah, no, it totally makes sense. Yeah, I mean, I'd say, there's always a working blueprint, right? The body always has a working blueprint. Probably, I mean, these are just off the cuff numbers. I'd say a good 85 to 90% of the time, yeah, it's a situation to what you're laying out where, okay, something's coming in, it hurts right here. And it's just like, yes. And everywhere else besides that place is what's tight. Everywhere else besides that, right? It's like all roads lead to Rome. You have to go to the roads first. So, whereas there are times though, which is why it's so interesting, because there are times when you're just like, I just, please fix this spot right here. I just need, this spot feels tight. Just put your elbow here, right? If people will come in, I mean, not as much anymore, but certainly there's that mentality of just like, well, just fix what hurts. And, and there's sometimes where we just like, that is just like, there's one trigger point. It's more superficial when those happen, right? So it's not like this ongoing thing that builds up over years. If there's an initial, like if you wake up and sometimes waking up and sleeping wrong, that whole idea, oftentimes, well, not oftentimes it's a situation like what you're saying, where it's actually, there's more involved that's going on than just that part in the neck. But then there are times when there is just that one part in the neck, and you can just release that trigger point, and then everything feels so much better.
Yeah. Fascinating.
Yeah.
But yeah, now we're talking about it. It's like the same thing with therapy. I don't know, like Freud's like it's
Absolutely.
the mother, and it's like, is it just the mother? Like, yeah, we can look
Right.
at like
Just
attachment.
deal with that, and then it's all good. Yeah, totally.
Yeah, so
Mhm.
yeah, it's there's I like your reference, like you're looking at the roads to Rome too. Yeah, love that.
Yeah.
Okay,
Yeah.
so we've talked about this already, but I'm a therapist, you're a therapist, you're also a body worker. So therapy, I think we can agree, is not the end all be all to healing journeys, right? Just simply talk therapy. So, can you share some examples of how body work has been an adjunct to psychotherapy?
Yeah, definitely. Gosh, I love that. Well, that's what's so great right now. So I have two different practices, right? So one is going to be psychotherapy where there's times when it makes sense to add in some ethical touch. For people that come in for body work, which is another practice, so I have a different website for that. Oftentimes those folks are also in psychotherapy.
Mm.
So I find that so examples of where it helps is when there's some um, just topic that's kind of being kicked around, right? Let's say it's a relationship, back to some of these codependent themes, and um, so let's say someone wants to talk a little bit about. We're just kind of inquire to like what's going on in that relationship. What does it bring up in the person, right? Not so much about the details of whatever the situation is, but just kind of dropping in a little tincture of whatever that is, and then how the body. What do we notice happening in the body when that happens?
Mm.
And then the ability to go further and like release, get some movement in the shoulder. I feel tension in my shoulder. I want to like, really, I find a lot of like this almost feeling like my fist clench, and there's all this sorts of, this is a thing that happens in the body. It's just like, okay, well, let's work with that, right? Let's open up that area. Let's have a full range of motion. What's it like when it's open? What's it like when it's closed? Right. And so and releasing trigger points of different things that'll show up in that process. So then it's like this full bodied exploration
Mm. Right.
of what's happening. And if the person is in a place where they can connect the thoughts, then we're kind of really showing what happens for them.
Right.
And so they get that deeper insight, and then their shoulder feels better.
Mm-hmm. So, yeah, I'm curious. Right, like you said, topics being kicked around, like the codependent relationship. What do we notice in
Right.
the body?
Why am I so angry, when this one dynamic keeps happening with my partner?
Okay.
Right. Or I'm noticing this pattern, and I see it, at work. Whenever my boss does XYZ, I just I just shut down. Like I can't say anything. I don't know what to do. And I just get really anxious. And so that sort of thing can be brought into a bodywork session.
Mm-hmm. And you just really try and like attune and like try and like center and focus on like noticing what happens physically in the body, like
Mm-hmm.
when like trying to recall that emotional experience.
It could be that, or I mean, to be honest, I guess I'm giving you more of the back roads, but the reality is a lot of people come in and be like, I don't know, my knee just started hurting, right? And then I'll ask, well, when did it start? What was going on? Was there anything specific happening? In my intake, I'll ask, has there been a loss in the last couple of years? Right. So oftentimes it's more people coming in from body work because there's already a physical symptom
Right.
that just feels like that's often what people say. It feels, I know I have trauma somewhere in my body. It feels connected to something deeper, but I don't really know. And I'm doing EMDR, I'm in talk therapy, I'm doing all the things that I can in the more mainstream idea. Right. And so I'm wondering though if body work would be something that would help.
Got it.
Maybe that's probably a clearer way to address it.
Yeah. Well, it just sounds like either way, yeah, either like a physical complaint and tracing it, or an emotional pattern wanting to be addressed.
Yes.
But yeah, like both, like again, like weaving in that like mind body connection. And yeah, for the body work part or like session especially, like really trying to tune in where is it in the body, and then yeah, working with that, like you said, like trigger point, or yeah, like massage or some type of
release.
Yeah.
Yeah.
I'm
Wonderful.
curious, like for people attending a bodywork session, um, if they're wanting to be intentional about it, what do you recommend for them, like before, during, and after, to to hopefully have added or like more benefit than just walking in, without as much intention?
Yeah. I mean, before, the more that anyone can put together what they think might be happening or when it started and what it might be related to, just to get their larger perspective and not feel like like they have to lead with the pain. And it just gives a larger foundation just to be, this is what's happening, and I feeling less at the complete mercy of whatever the pain situation might be, which can be pretty intense. So, and then I help that along often with my intake form, which is not that long, but I try to just touch on different aspects, how much water you're drinking, right? Just basic things. And then entering into the emotional landscape a little bit as well. Then during the session, just to be as allowing one to really drop into whatever might happen. It doesn't have to look a certain way. There's no way to, no one has to do anything to make it more effective or anything like this, right? It'll be as effective as it needs to be. And, I help people make a very specific, individualized plan based on what's happening, so we have some path that we're going down together. And then after, I usually will give some easy thing to do to just start bringing in some awareness around whatever's happening. So that'll typically be some sort of stretch or something, that stretch or a movement that will just start to open up the area, but also give more indication for the person to tune into, oh, wow, right, it's this movement that is where it gets sore, right? A little bit more of the on the ground, what's happening situation. And it depends. Sometimes something will come up where there's something to explore more emotionally, right? So just more of an insight, a mindfulness sort of task, if the person's interested in that, to note when and where this is going on the day to day.
Amazing. Yeah, well, I don't know. I think it's really profound, and I've definitely like gotten massages, which have, oh yeah, right. Nothing wrong with a massage. But yeah,
No.
I'll be like racing there.
Right.
Get my massage, which is amazing, but I might be thinking about 100 other things if I'm hyper codependent at the time. And then I like get dressed and I leave. And there's not like you said, just there's not this attunement or like where's the tension and like paying attention or just going internal. Even massages can be very disconnected. And so I appreciate your emphasis on what body work, can really just like the healing it can provide. Like you said, like a severe attachment with anxiety, codependency. So thank you.
Yes, thank you. No, what a wonderful conversation. Very rich. Yeah.
Yeah. Okay.
Great.
So if people are interested in learning more about you, Randi, where can they go?
Well, so I have two websites. So if people are interested, if they're doing therapy or they are therapists, Bodywork would probably be the first best step. So innerwavebodywork.com is my website, and people can book directly through that there. I also have sometimes things on Instagram, Innerwave Bodywork on Instagram. And then for people that are interested in psychotherapy, are interested in potentially bringing in some ethical touch to their psychotherapy experience, my therapy practice is innerrichestherapy.com, and there's also an Instagram for that too, but that's not the most active at this point. So but those are the two main places where I can be found for sure. And my practice is in Santa Monica, and it's near the 405, so it's not all the way over by the water.
Okay, good to know. That's very important for us.
Locals.
Yes. All right. Well, I will put links to both of those in the show notes. And again, thank you for coming on. Dear listener, thank you for being here. And I will see you next week.
Thank you so much.
Hey girl, it's Marissa again. I'm not like a regular podcaster, I'm a cool podcaster, right? Thank you for listening and staying till the end. You can find me on Instagram at Therapy with Marissa. Email me, marissa@codependummy.com. Check out codependummy.com for more information on the show. And baby girl, a subscribe, rating, and review would be much appreciated. Till next time, I want you to remember, if you are feeling unseen, I see you. If you are feeling unheard, I hear you. And if you think that you don't matter, know that you matter to me. I want you to go out there so you can stop playing small and start taking up space, you dummy. And now, the disclaimer. Girl, this is not therapy, and I am not your therapist. This podcast is designed to provide accurate and authoritative information in regards to the subject matter covered. It is given with the understanding that neither the host, publisher, or guests are rendering any legal, clinical, or other professional service. If you want or need a professional, please find one.